Good morning. This is Kevin Kirkpatrick, CEO and founder of the Avery Professional Group. I thought I would do a little video this morning because I didn't feel like typing, so I could post this out to my LinkedIn network. Just wanted to talk about what we're currently working on. I am working with a couple organizations to redesign and develop their recruitment process, predominantly focused around healthcare staff and creating a structure that allows them to recruit consistently, effectively, and efficiently. Other things, we're currently still working with the province of PEI, looking for an anesthetist, general anesthetist, community-based, in either Summerside or Charlottetown, PEI, looking for emerge physicians for them as well, and family medicine right across the island in all kinds of different communities. So there's a lot of variety to choose from. As well as internal medicine physicians to work with inpatients in the hospital. The beauty of PEI is there's multiple opportunities and options around compensation, whether it's fee for service or a salary. So if you're looking to relocate from somewhere and want the consistency and stability of a salary, that is definitely something they can offer. The total population is about 164,000 people. So, it's definitely going to have a great community view. And if you look at the real estate is much more affordable than areas of Ontario. So if you're looking to downsize while still keeping up a clinical career, PEI might be a great option for you. If you're in the UK, PEI is also another option to relocate to and enjoy the Canadian lifestyle. Also looking for some preventative care physicians in Calgary and Vancouver. It's a bit of a different model. A full roster consists of 400 patients. So it's a bit more focus on spending time with the patients than volume. So if you're looking to really focus on preventative care and driving deeply into each of your patients' conditions and scenarios, then that might be a fit for you as well. Both opportunities are downtown Calgary and downtown Vancouver. So you're going to want to live in a city or close to the city. Also looking for general internists with several hospitals in Ontario, either to work doing internal medicine consults or doing hospitalist work as well. So our clients range from a patient roster of about 17 to upwards of 24, depending on the size of the hospital. Also looking for emerge physicians in several locations in Ontario, as well as obviously PEI, as I mentioned before. Just seems to be a large volume of hospitals trying to manage their physician workflow and workforce. These can be on short-term locums as well or permanently, depending. Each community has a bit of a different footprint, so depending on what might interest you, there's going to be a little bit of different nuances to each. Also looking for several specialists, anesthetists, urology, ENT for our friends in Peterborough at the Peterborough Regional Health Center. Great community, great hospital. It's about over 400 beds, so it's a large enough footprint for great opportunities in a cottage town with some great culture and amenities with the university and college there as well. Also looking for family physicians in a bunch of different locations. And we are likely signing a contract with a client, that has 4 locations in Ontario that they'll be looking for family physicians for a managed practice setting. And lastly, just really looking to work with physicians that are interested in potential leadership roles. We are seeing some clients right now looking for chiefs of programs, chiefs of staff and stuff like that will be coming up over the next 6 months. So there's some preliminary work going on there. And lastly, just also looking for anybody that's interested in participating in webinars around healthcare issues. Every couple of weeks, I like to do a webinar talking about something. Predominantly right now, it's been related to physician recruitment, but I would like to talk to people in the physician realm, nursing realm, and any type of healthcare person that's interested in doing some advocacy and doing some social media around important issues, whether it be staff retention, workforce planning, because unfortunately this province and I think the country in general has done a poor job of planning for changes in workforce and changes in practice patterns and stuff like that, right? So whereas, a prime example, my family doc growing up as a kid had a roster of about 3,000 patients based on the work and the administrative toll of being a family physician. Now it seems like the average roster is about 1,200 patients. So knowing that we should be, we should be training double the family physicians as in the past. I also encourage people to check out Lake Ridge and Queen's University. This week they announced an amazing process and program targeting family medicine, where they will have a large number of residents starting med school in Oshawa with Queen's and Lake Ridge now. They'll do their 4 years of med school and 2 years of residency in the Oshawa area. So as someone who lives in that area, that's a great endeavor for us to likely potentially retain a bunch of these residents when they've graduated, because if you spend 6 years somewhere training, there's a very good chance that you'll fall in love with the area and the medical community and want to work with those peers when you graduate. Congratulations to them, to Queens, to Lake Ridge. I'm very excited, and it shows a great leadership to move that forward. I'd love to see us do that in more communities across this country, because I've seen the value of some communities where they retain a large portion of the residents that train there. So it's probably the best recruitment activity. So way to go, Queens and Lake Ridge. And so either way, happy Thursday. It's August 31st, which means we're getting close to back to school and at the end of summer. So take as much time outdoors doing fun stuff as you can, and as much time with your kids, because we're back to the grind. Take care and have a great week.